stay on mute throughout the entirety of the session. If you have questions, feel free to put them in the chat box and we'll address them as we progress through the night. And then you can also be sure to let people know that we're streaming live on Facebook if they want to drop any questions or comments there or share this session. So I'm going to give us just a couple more minutes because I have something in my eye.
We are live, Marissa.
I'm just being honest. Just 1 minute.
And good afternoon, everyone. We will be beginning shortly. Okay, Marissa, we are live.
Thank you. Thank you. So good evening, and thank you everyone for joining us for our two-part series on the history of Black maternal health. Tonight's session is the close to a series of events sponsored by First Year Cape Fear and New Hanover Regional Medical Center's Health Equity Department to acknowledge Black Maternal Health Week. So throughout this week's events, our goal is to provide our care providers and our community with insight, expertise, and education surrounding Black maternal health and Black maternal health disparities. So thank you again for joining us, and we hope that you're able to add something new to your toolbox. So we'll begin tonight's session with an introduction of our panelists, followed by our discussion. And then as we progress, feel free to drop some questions or some comments in the chat box, and just be aware that we're on Zoom and also streaming on Facebook Live. So feel free to like, share, and get some more people to add our discussion. So without further delay, I'm going to introduce our panelists for tonight. Unfortunately, Crystal is unable to join us tonight, but we are going to keep her in our thoughts. So I'm going to start with Jhaniqua. Jeanipo Palmer serves as the program coordinator for the YWCA of Lower Cape Fear and their Grandparent Support Network and Advocacy and Racial Justice Program. She holds a bachelor's degree from Bennett College for Women, a master's in public health, and is a proud member of Alpha Kappa Alpha Sorority, Inc. Jhaniqua strongly believes in empowering women and eliminating racism, which is the mission of the YWCA. She centralizes her work to promote justice and equity for all people by advocating through intervention and proactive community programming. Thank you, Jhaniqua, for being here tonight. And our next panelist is Lettie Shumate. Lettie is a historian, anti-racism educator, facilitator, and podcast host in Wilmington, North Carolina. Lettie received her Master's of Arts in History in 2015, where she focused on American history and specialized in Black history and race studies. She also completed her Master's of Art in Conflict Management and Resolution in May 2020, which equipped her with skills to incorporate effective communication with hard topics and how to navigate these situations. She also is skilled in mediation and facilitation knowledge, and this Master of Arts contributed greatly to her work as both a historian and anti-racism educator. So thank you, Lettie, for being with us tonight. Awesome. So I will be your moderator, and also participating on the panel throughout tonight, I'm Marissa Bryant Franks, Health Equity Outreach Coordinator with Novant Health New Hanover Regional Medical Center, and also I'm here as a representative of First Year Cape Fear. So for those of you who don't know, this is the second part to our series on the history of Black maternal health. So we're very excited to revisit some of our discussion from the last time we spoke, and really delve into some of the present day disparities and issues that we see when we talk about Black maternal health and how it relates to history. All right, so like I said, feel free to put some questions in the chat box, and I'm going to kick us off with some questions that I have for you ladies. The first is in relation to COVID-19, right? So COVID-19 is still around. It was around all 2020. And we know that it further exacerbated gaps in care delivery for everybody. But these disparities for Black women were already significant and pervasive prior to the pandemic. So what are some ways that COVID-19 worsened access to quality maternal care for Black women?
I guess I'll start if that's okay, Lettie. Some of the things that we have seen in regards to Black women and COVID-19 is, of course, increased awareness that Black women are not in pain, and that the pain that is existing is not something that is necessarily real. And so you also see the mistrust of doctors. You see patients being sent home. You see misdiagnosis of Black women, and even sometimes like their symptoms haven't been taken seriously. You also see the growth in the numbers of deaths for Black women when in regards to COVID-19 cases. You see, I think those are some of the things you see. Lettie?
Yeah. And you touched on quite a bit. I'm going to be looking away too, because I was adding notes to the questions earlier. So just to let everyone know, that's what I'm looking at. Yeah, so there's 2 points that you mentioned, Jhaniqua, that I actually had down on my list. And one was about like the fact that people think that Black women, right, don't feel pain, and what that's rooted in, because a lot of this, all of this, constantly goes back to systemic racism. And with COVID-19 in particular, whenever people were losing their jobs, a lot of the people that were losing the jobs were already people who were working the jobs that if they did have any health insurance at all, it wasn't a quality at all. Also, something else that was pretty big last year, whenever the pandemic, I won't say started, but came to our attention, was the government and healthcare in general with the Affordable Care Act and what that did for businesses and to businesses. And so, yeah, people don't have jobs. How are they going to have health insurance, right? And look at the populations that were affected the most by that, and Black and brown communities, specifically Black people. So yeah, I would definitely add that to it.
And I would say also Black women, Black and brown women being in position of being essential workers, of taking the jobs that like also didn't close, but also paid $7.25, $8.25, $10 an hour, where, you know, they still had to go in and clean homes. They still had to show up at hotels. They still had to show up at the grocery store. Walmart never closed. I mean, there are several companies that never closed, and the majority of the employees are Black and brown people, which also increased to their level of exposure to COVID-19. And you know, I think that was the other part. I think another part that is also important to add with COVID-19 is the level of mistrust from the media for Black and brown people, the mixed messages for Black and brown people, the fact that some people thought COVID actually really didn't exist. A lot of it came from Black and brown communities where people where maybe the media wasn't taken seriously, whether their employers weren't necessarily taking it serious. So like, hey, I'm not feeling well, and the employer says still come to work. And what do you do when you have children to feed and you have a house to keep? You go to work, and potentially even expose others. I participated on another discussion, and they had a woman there who exposed her family to COVID because she said the media said, you know, she watched the one interview with the former president, and he said not to take it serious, so she didn't take it serious, and she never followed up with the other interviews with the other doctors and scientists that came on to say, no, we have to take COVID seriously. So she actually didn't take it serious. And so I think we also have to bring the media and hold the media accountable for some of the mixed messaging that our community saw, or the lack of messaging that our communities have not received. I think that's also important to share.
I think that is really important. Thank you, Jhaniqua and Lettie. I'm also thinking of, like, from a clinical standpoint, some of the barriers that we saw in people being able to access care, right? So access to care or quality care was already a barrier for our Black and brown moms. And then when we look at COVID-19, a lot of people had to access care using telehealth, but in order to utilize telehealth, you've got to have internet access, right? So think about our rural populations. And what if you have something that could potentially be severe or threatening to your pregnancy, and you are not able to even go into the doctor's office for some time? So those types of things. And then I'm also thinking about in terms of support persons. So those restrictions for visitors. You can only have one person there to support you throughout your labor. So those are things that I think continue to exacerbate the disparity as well. But when I think about some of what you guys are saying around workforce policies and some things that were happening when we talk about our frontline workers being mostly impacted, I'm also thinking about some of these policies that impact just general maternal health, right? So one small element that we talked about during our last session is things like paid maternity leave or paid time off for a doctor's visit. And so without access to these things, it's easier for women to have medical issues that go untreated or undiagnosed, ultimately impacting their pregnancies or reproductive health. So just last year, we know that the murders of unarmed Black people, including George Floyd and Breonna Taylor, just to name two, served as a catalyst for more racial justice and equity movements all throughout the nation. So this has included more intentionality supposedly around diversity, equity, and inclusion initiatives and action-oriented solutions that are going to impact corporate and community spaces. So a lot of people, rightfully so, are apprehensive that these things are going to be sustainable. They think that they're performative, that they think that they are quick fixes to the larger issue at hand, obviously for good reason, right? So what advice would you give to people who are working to align, when we talk about Black maternal health, to genuinely incorporate diversity, equity, inclusion into their strategies and their culture?
I'll start. I mean, the first step I would say is to acknowledge the fact that implicit bias is what people have, especially white America, whenever it comes to Black and brown people and healthcare in particular. Also acknowledge the fact that the Black Lives Matter movement makes a lot of people angry, and it makes people uncomfortable, and people want to just also jump on the bandwagon and say, oh yeah, this is what I agree with. But whenever it comes to actually taking action, it requires sacrifice and it requires a level of selflessness that I don't think people are actually grasping. And that's why last year in May, whenever the world watched George Floyd be murdered, there was this uptick, right, of protests and things like that. Yes, absolutely. But I was over here like, yeah, well, we were doing this back in 2012. Actually, it's been happening since 92. Actually, it's been happening since 64. Actually, it's been happening the whole time. So this is nothing new, right? So Black people have been dying at the hands of state-sanctioned violence. And it's the same state-sanctioned violence that we see Black women experiencing whenever it comes to maternal health. Period, right? Like, it's all connected, and people want to isolate it. It is not about isolating, it's about seeing it as the whole that it is. You cannot isolate history. You cannot isolate these factors that continue to go into what upholds white supremacy. So acknowledging all that, what I just said, and also doing that internal work. It is not going to be as simple as, all right, well, I'm gonna check off this box and I don't fall into this category. Actually, you probably do. And you need to take time to really examine that, because whenever you come up against people that you see as your friends, your family, whoever it may be that's going to push back against you, you're going to want to go along with that too, because it's going to be uncomfortable. It's going to be hard, but you have to ask yourself, right? Like, do I care more about this temporary comfort where I don't want to rock the boat, or actually do I care about Black lives? Do I care about Black maternal health? So definitely that is just a foundational start, right? And whenever I talk about this with people, they're like, oh, well, that seems like a lot. Okay, but we didn't create the system, right? Like, we did not create racism. So it is not our job to fix the problem, right? if we're going to be about progress and change, you have to ask yourself, progress and change for who? Because 9 times out of 10 in this country is progress that's temporary and that feels good. Because after January, we've seen that people are getting comfortable again and they're like, oh, but 45 is gone. Everything's fine. No, it's not, because history shows us time and time again that it doesn't matter. Politics and what goes into these laws and these policies that are written are Democrat, Republican, like it's across the board, right? And so I would say starting there, even though I know I just said a lot, but it's very critical that people connect those dots, because otherwise what we've already been talking about in the last 14 minutes, it's going to not seem like it's going to connect, right? Because everything that even Jhaniqua said before connects to what this is. Like it's all one. So yeah.
And I would just like to speak to the performative aspect of it. I believe that all of the DE and I efforts will be performative if companies and organizations do not infuse diversity, equity into the structures, into their strategic plans, into the morale, into the environment and the community of their organizations. Diversity and inclusion is not something that you just say, hey, we just hired 3 Black people, we have progressed. That is not diversity and inclusion. Diversity and inclusion revolves looking at your company, looking at your numbers, looking at your demographics, not just who you employ, but who you serve, and ensuring that it looks like you're serving Black people, brown people, people with neurodiversities, people with who have different types of body types, people who are pregnant, people who are young, people, parents, mothers. All of it is making sure that you are serving a balanced plate and making sure that your strategic plan, your core values all align with diversity, equity, and inclusion. And until companies take it seriously, and until executive leadership has buy-in, until the mayor, into the Chamber of Commerce, into the board of directors of hospitals, and all of the people who have the power to make decisions, until they sit at the table and look around and make sure that everyone is represented at the table, then it will be performative. And so you're sitting at the table and saying, you know what, I'm not an expert in this area. Why don't we bring someone from the Latinx community to come and speak? Or why don't we hire people who have different perspectives other than the 4 white men that typically sit around the table and make the decisions? I think it will be performative. And so that does feel like a defeat. It does feel like, well, Wells Fargo came out, Microsoft came out, Amazon came out, all of these major companies came out with these D&I goals, these promises. And so far, some of them are holding up to the bargain. The other thing is, creating a diversity and equity environment is not something that happens overnight. It is going to take time. But just because it's going to take time doesn't mean we don't allow ourselves or give ourselves the permission to do all that we can while we're on this journey. None of us created the systematic racism that we see. However, we all play a part. And until we say no more, until we say, thank you so much for the promotion, but, my coworker has been working extra hard. She stays late. Did her performance evaluation equal mine? Until we look around the table and push the gun, I think it will seem performative.
I love it, and those things are so true. And I want to comment on something in the chat box. Joe said, at the table, and they have a voice at that table, which speaks to everything you just said in reference to inclusion. And that is so, so important. And I think Elizabeth, who is on the call, she also explains it as being invited to the party, but not asked to dance.
Exactly.
Right?
And
so
I think
don't invite me if you're not ready, right?
Yeah. And I think Marissa, we have to be honest and say, that people are afraid. And the thing we have to remind people is what are you afraid of? You know, are you afraid to get out your comfort zone? Are you afraid that you want to come to work from 9 to 5, but parents may find it easier to come to work from 7 to 4, or they may find it easier to come to work from 8 to 12 and then work from home after they pick up their children. Like, you know, I think what the fear also is that life doesn't continue the way that I see it right now. But I will say that we also have to look at maybe some of the legalities that come behind not embracing diversity, equity, and inclusion. You know, not having a diverse platform, not having a diverse organization, there could be Title VII lawsuits. You know, like embracing diversity and being inclusive could save your company lots of money. So I think, you know, as we are wanting our businesses and organizations to move forward with diversity and equity and inclusion, and for it not to be performative, I think we also have to remind them that there are benefits to being inclusive. And that is not all that you're giving up something, but again, it is allowing people to show up as their authentic selves and creating policies that allow people to be their authentic selves at work.
I think that is so true. And Lettie, did you want to add something to that?
No, I was just going to say about people, like the whole question of what are you afraid of? But that's actually a question people need to reckon with, and really the country needs to reckon with it, because what comes with that is also accountability and responsibility for the programs and the defunding and all of the budget cuts and everything else that goes into the lack of access for Black people and for Brown people. And it is very, very evident. We've seen it in the last year. And what happens is there's constant excuses that are made. There are constant excuses on the individual level. We just saw that this week with the most recent murder of a Black person. There's always an excuse. There's always some kind of excuse for everything. And so the question also becomes, what is it going to take? Right? Like, what is it going to take for you to actually care and say that your morals and your values are what they are, and you admit that they're actually not for all people, that they're just for people that look like you? Like, when is white America going to admit that? And I know that I keep saying white America here, and I want to be clear that I'm not saying that as all white people are bad. That is not it at all. But we have to speak factually and collectively about what's happening in this country. There's no mincing the words here now, right? And also to say that white supremacy culture is upheld not just by white people. It is upheld by Black people and by Brown people. It is upheld because we're all born into this culture. We all uphold that. Now, that is not to say that we can be racist. Let me just make that clear. But we can't uphold white supremacy culture, right? And so I just wanted to make that little distinction there. Someone goes,
we got to be clear. We got to be clear.
Yeah. And by now, anyone who knows me knows I'm pretty much that person. But yeah, I just wanted to add that part, to just go off of what you were saying about what are you afraid of? Like, what are you afraid of?
And can we push it a little bit more also, Lettie, to say, you know, when you as a hospital make initiatives to hire more Black and Brown doctors, to go to places like Meharry and Morehouse to recruit, it can save a life. And that life is worth saving, because one mom having a connection with a Black or Brown doctor could save her child's life and could save her life. And so when you're thinking about life and death, especially when you're working in a healthcare setting, when you're thinking about maternal health, making these initiatives saves lives. Yes. It saves lives.
Mm-hmm. I absolutely agree, because we often say, right, that like representation matters, but it really does matter though. Like it really does matter, because I feel like what happens is, and you were speaking to this earlier regarding diversity and inclusion and the need to like really be about inclusivity, because you can't just sprinkle Black and Brown people in there and call it that, like, that's not, no. And so it goes into that too, right? Like representation matters, I've seen is a phrase that's gotten co-opted, right? To say, oh, but see, representation does matter. And see, we do have people here that are not white people, but that's not all that it means. It means something as as personal as what you were just explaining, right? How it could save a life. It could instill that trust. It could allow someone to feel safe and to feel like they have autonomy over themselves. And that is extremely important when it comes to the history of how we haven't had autonomy over ourselves. I mean, let's just go and cue American history, right?
And one small thing I want to add there before we switch gears a little bit is when thinking about inclusion, I was just talking about this with a colleague earlier. Don't think that you're being inclusive if you include me after you've already planned, right? You've already decided what you want to do. You've already made all the plans. You see it might not work or it's not working. And now you're inviting me for my insight, or now you're inviting me to be the voice of your initiative because you need someone who looks like the people that you want to serve in order to engage them. That's not how we do it, right?
Or so even using the language when you don't mean it. So I'm putting inclusion in things, but I don't necessarily mean it.
Mm-hmm. Right.
I want to say I want to focus on minorities, but the minority I'm talking about is the 2 Black families that we found, and that's it. Mm-hmm. So yeah, you actually have to mean it.
Mm-hmm. Yes, and I want to make a comment real quick too on that is that is really, really frustrating, because then it's like all Black people are a monolith and we are not. Like, we are not all the same. We do not experience, like we do not all have the same lived experiences individually every day. Do we all experience the same like racist society? Yes, we do. How are we all affected by that? Yes, whether some of us think that we are or not. But also, yeah, it's not just about, all right, there are these 3 Black families, and see, we are being inclusive because, oh, we've already planned this program and now we've called Marissa in to also say this. No, Marissa should have been talked to and been a lead voice in this if you're going to be about inclusion, because she's a Black woman. It is not, she should not be an afterthought, right? Like, we should not be the afterthought to then give the brownie points, or give the white people the like brownie points, make them feel good about themselves. Like, no, that is not what this is. And that's when it becomes too often. That does not mean that the intentions are not good. And I do want to say that as well.
But Lettie, intentions right. are great. But intentions don't mean anything if the outcome is racist, is a microaggression, is oppressive. Intentions don't mean anything.
No.
One thing that I have learned in my diversity course that I'm taking is that, like, intentions are cute, but they don't mean anything if the outcome is still the same. So, like, saying I want to diversify my candidate pool, but I only interview maybe 2 minorities or 2 underrepresented populations, that you're going to have the same outcome.
Right.
And so intentionality is great. And intentionality kind of makes people not feel so oppressive. Or, it makes people feel like, okay, so maybe that action wasn't a microaggression because that wasn't my intention. But your intentions don't matter.
Yeah.
If the outcome, again, is oppression. Like, it doesn't matter. It's great, but it doesn't matter.
Yeah, it's great, but it's the impact that matters, period. Like, that's just it. It's just the impact that matters. And people need to just deal with that fact and stop with the whole, and like understand that you're going to take that personally at first, but like to get past that, because if you're really about being inclusive, then you're going to not want to center yourself, because that's something that happens far too often too. So yeah.
Thank you for that, guys. That was a great dialogue. And I'm going back to one thing that you said, well, multiple things, right? So we talked about microaggressions, and this reminds me of a little bit of our training that we do around microaggressions within our department. And we talk a little bit about racial battle fatigue, right? And how just being in this environment every day in a workplace that maybe is not inclusive and it's not diverse, or it doesn't consider you until after the fact, you're an afterthought. It can cause stress, right? It's like battering. And so when you think about those things, I'm thinking about stress, I'm thinking about mental health. And so I want to go back to this general idea around maternal health, which extends far and beyond pregnancy or even childbearing age, right? And so last time we were together, we touched briefly on how do we preserve our general mental well-being as Black women, and what is the importance of community participation in motherhood as Black women. And so here in Wilmington, when you look at how violence has upticked and more parents are experiencing loss and grief, I'm thinking of structural violence. And how does this play out when we talk about the historical context? What does that look like in history?
It's a lot there.
Oh.
There's a lot there.
That is loaded.
Yeah, there's a lot there.
Let's break it down a little bit.
Yeah, I was going to say, I was trying to find, because I took the questions and put them in my note, but I can't find it. I was scrolling trying to find it. Yeah, so is it more, you're asking about, I'm trying to clarify, you're asking about like how we see history play a role in like generational trauma with Black people?
Yeah, generational and historical trauma, and then how does that play out as violence in our communities? And that ultimately contributes to grief and loss and stress, right? And so it all comes full circle when we talk about health in the workplace and we talk about health in your community. So what is the historical context of this when we look at what's playing out in our communities today and this structural and systemic racism that ultimately leaves people without resources, without access? What does that look like?
Yeah, the first thing that came to mind is and this is something that I find isn't talked about often enough with racism and with white supremacy, is the criminalization and the condemnation of Blackness itself. So the criminalization and condemnation of Blackness was needed to justify racist laws, racist policies, especially after the Civil War. And Black people were institution of slavery ended. Let's just say that, because the re-enslavement of Black people happened immediately. But the criminalization of Blackness required crime to become something that white America created, when actually really the real criminals were the white people. And I'm saying that factually. This isn't like an opinion or anything like that. No, this is like a fact. But America has always needed some kind of scapegoat, some kind of something to justify its actions and as to why it allows white supremacy to prevail. And so easy thing to do was to go along with the racist stereotypes of Black people as savages and barbaric, which is whenever you also had, and we saw this right here in Wilmington, the 1898 race massacre. And Alex Manly, whenever he wrote his editorial piece, which refuted the white woman in Georgia, whenever she said that all Black men should be lynched. Okay, these are the racist stereotypes that actually go along with the criminalization of Black people, right? And so when we think about this, we think about also, and I'm just like going off here, so I'm just trying to like connect the dots. But we would think about, right, like migration of Black people to northern cities, right, to the West, starting in the late 1890s. And you think about this, right? People are like, oh, but they went to the North. Yeah, but they created the ghetto. They created the ghettos, and they actually took that. And this country really copied a lot of Germany, right, with the Jews and how they were treated. And there's a whole connection there with this country and that. But there's a lot that goes into that too. We could have an entire webinar just on what I said, but it's important to recognize that, because then you start having things that are said today like Black on Black crime and this and that. And Black on Black crime is actually a myth. So there's that. I won't even get into that here though, but Black on Black crime is a myth. And what happens though too is you have wound up in this, you have redlining, you have gerrymandering, you have the schools that are in these areas that do not have the materials for Black children, which also then contributes to the lack of education for maternal health, for health in general, and I'm gonna go back actually for just a second. So my brain's going like real fast. But also to go back, you think about what is the one thing that enslaved Black people were not allowed to do? Like absolutely we're not allowed to do, okay? What also was not funded after the Civil War? What actually was one of the biggest downfalls of the Reconstruction era. And I say downfalls, and really the Reconstruction era was hijacked because of white supremacy, but it was education. It was education. We were not allowed to read. Schools were burned down during the Reconstruction era. Think about desegregation efforts here. Like, what was targeted the most? Kids going to school. What was bombed more than history books say they were? Schools, right? Like, what did Black people want to do? Educate, teach, read, because it's been something that has always been powerful. It's been something that's always been about having knowledge, right? And all of this, you know, as a historian, I have to think about all of that when talking about these, because we're people. We are people. Our ancestors were people who fought for us to be here right now. Were people that had to fight these exact same things. Like, you had people like Ida B. Wells and W.E.B. Du Bois talking about the criminalization of Blackness and how it's going to affect the Black family in the 1890s and to like the 1940s. They were talking about it then. And here we are now, right? So having these same conversations. And so whenever it comes to violence, also, Angela Davis said this in, it's a film called The Black Power Mixtape. And she said, and I don't know the quote off the top of my head, but she basically said that whenever someone asks her about violence and why Black people are violent, she finds it absurd, because she's like, we are violent? Us? Like, we experience violence from the time we were taken from like Africa, right? And so she says this in the height of the Black Power movement as well, the height of a time in the country when Black maternal health was really being attacked, right? And so all of that for me goes into violence. It's not just something that's violence as far as physical crime, right? Like gunshots and things like that. I think also
structural violence.
Yeah, it's just it's so much bigger, and what violence does to the Black community and what happens whenever people are in proximity that are experiencing the same violence, that are experiencing the same oppression, that are experiencing the same generational trauma that's not treated because they don't have access to therapy, to counseling, to these things. Like, there are books written about it. It is right there, right? And so again, back to my question before, like, what is it going to take for people to see the actual issues? But again, with this, it goes back to the criminalization and these racist ideas that are passed down. In the same way that we have generational trauma done with racism and white supremacy, on the other hand, I also think, and I'm like, right, but what about that generational trauma? But actually what it was were people who were creating these oppressive laws that were happy about it, that were smiling about it, right? Like, these ideas get passed down, and it sounds odd to people, I think, sometimes, but it's really not. It's actually really not whenever you see how it's affecting people every day. Yeah.
So I kind of understood the question just a little different. A couple of things that I thought about was, one, a story, a slave narrative about a slave being a midwife and being pregnant, but she had to be on duty for the mistress, and literally had miscarriage after miscarriage after miscarriage because she was a slave and she had to attend to the slave owner's wife. And how does that show up in her family? Generations down the line, historically, what type of historical trauma are the people from her lineage now experiencing? Could it be more miscarriages? Could it be fibroids? Could it be tough and very hard and difficult pregnancies? I know that there's research now that is starting about how historical trauma shows up in our bodies. But I think about that story. I also think about something that we use a lot right now in Wilmington to address resiliency, which is ACEs, the adverse childhood experiences, adverse childhood environments. I think about how children growing up in adverse situations, and in the long term, they end up with lots of health complications and even end up having a shorter lifetime span. So when you think about our country and its origins, I think about how after Juneteenth, that most African Americans celebrate, right? I think about after that, how did families pull resources together? They didn't have any resources, right? But we pull resources together. How does that look like now? It looks like that there's a wealth gap because there was no wealth for Black communities. Or when Black communities after Juneteenth became successful, like Black Wall Street, where they created environments that were successful for Black people, they were bombed, they were destroyed. And so again, there's no wealth. When I think about Wilmington, like Lettie, you mentioned 1898, Black people, biracial people, Native people, they own property here down on the riverfront. If those families still own property down by the riverfront, what would that wealth look like? That would look like our schools wouldn't be failing. The brown schools, particularly Black and brown schools, are failing. It wouldn't look like that. I think the shape of America would be different. And so when you look at situations that happened a couple of weeks ago with the mass shooting in Wilmington, a lot of people wanted to jump on the Black community. Like, this is happening in your community. Y'all, Black people need to stop shooting each other. It's just too much violence on the street. But do you know a Black gun manufacturing company? Do you know Black and brown people who have control of the gun laws in this country? I know that's an awkward silence. It's meant to be awkward because it's very easy to look at the situations now, to look at failing schools, to look at Black crime and violence and say that it's just these people. But we have to acknowledge that there was a history and there's a structure that's set in place for that mass shooting to happen. So then, Marissa, what does that look like for grief for Black mothers who have to be afraid for their Black sons and Black daughters to leave the house? What does that look like, the grief for Black communities that have to rally behind families when Black shootings happen and then show up to work and be told it's your fault? That grief looks like it looks exhausting. And it is exhausting as a mother with a Black son. So as a woman with a Black husband, it's exhausting to turn on the TV and see yet another Black child was shot by a white police officer. It is exhausting. And the grief needs to end. So I don't have an answer for how do we help the grief, but I know the grief needs to end.
Thank you, Jhaniqua and Lettie. Those are amazing responses. And I put something in the chat box while you were talking, Jhaniqua, because I didn't want to forget it, but I definitely wanted to mention it tonight, because we know that we just unfortunately lost a wonderful artist, DMX, right? And when I think about ACEs, that's who I think about. Adverse childhood experiences is what ACEs is, to answer your question, Rachel, and you guys could chime in a little bit more and talk about ACEs, but it just pretty much says that exposure to adverse childhood experiences like sexual trauma, domestic violence, a parent who leaves the home or feeling abandoned, things like that.
Being exposed to drugs.
And yes, all of the above, right? Anything adverse can ultimately impact your own health outcomes as an adult. So there's a study that was done that shows that this is true. And oftentimes minorities are more at risk for these things, right? Because of exactly what you're saying, structural violence and everything that we just talked about, pretty much. So when I think of this, I think of someone who grew up struggling. So without resources, without a parent in the home, struggling with addiction, and just passed away, right? So when I think of adverse childhood experiences, when you look at from childhood to adulthood, this one instance is the perfect example of what that looks like. So, and those health outcomes could be anything. It could be hypertension, it could be diabetes, it could be
heart disease.
It could be issues with your reproductive health. It goes back to, thinking about how all these things are associated with stress. So it all comes full circle ultimately. So yes. And so that takes me to my next question for you guys. And I want, of course, the audience continue to put questions in the chat box as you have questions. We wanted to give you 30 minutes for any questions that you guys have, but if not, I'll just keep talking. So please do put some stuff in the chat box. But yeah, so you talked, Lettie, about how nothing is isolated, right? Everything comes full circle. And we talked a little bit about schools, and I really want to talk more about schools because we talked about this last time. So we looked at that one graphic about how the intersections of historical events like historical trauma and some of our other systems such as housing, education, and justice kind of come full circle. And so thinking about education specifically, how are some of the gaps that Black and brown children in our school system are experiencing impacting maternal health outcomes?
So one thing that I would definitely like to bring up, I know the NAACP right now has the petition going to end school expulsions, to stop middle and elementary school, I believe primarily, from suspending students because Black students tend to be expelled from school 3 to 4 times more than their white peers. And this includes pre-K on up throughout their education. And I think when you think about what happens to children when they are expelled in lower grade levels, you have to think they're missing fundamental face-to-face instruction. So if they're missing fundamental face-to-face instruction 3 to 4 times more likely than their white peers, when they take testing, they're going to be behind. When they go to the next grade level, they're going to be behind. And so ultimately, what it also does, it creates another education gap. Some other things I would like to talk about in regards of education is that children, when Black and brown children are expelled from school, and then let's say they get expelled for minor offenses compared to their counterparts, and this even includes Latinx and white people. So they could offend a teacher, and the teacher just automatically goes off the handle. You're suspended. Where when other students, white and Latinx, do it, they maybe will receive a lesser offense. And that study was actually done in the Texas educational system. I think the other thing that I would like for teachers really is to be aware of their bias. Bias and implicit bias is a huge influence on how our Black and brown children and Native children are treated in the school system, down to identity. Checking the box for a kid. You don't get to check a box as a teacher for a child. The child gets to decide what their race is. It's their choice. You can't look at someone to determine their race. So from deciding that to, there was a study done, I believe by Princeton, it was either Princeton or Yale, where they did a study. They asked preschool teachers to come in a room, and they said, observe for misbehavior. None of the kids were going to misbehave. The actual study was about bias and implicit bias. The study actually monitored the eyes of the teacher. When they did the study, teachers, both Black, white, Latinx, brown, Native, that were in the study, they all looked towards the Black boys to look for misbehavior. They didn't look at any of the other kids by a landslide. So when you think about the studies around education, you have to think about, what does this look like for me? What does this look like for my child? And what does this look like for me to advocate for my child? And so I think those are some of the things that we see show up. We see the increase in expulsion, and we also see that bias comes into play with teachers. I would definitely recommend, if you type in like microaggressions in high school, there's lots of videos that show teens' reactions to how they are treated in school and what that looks like based on race and now based on gender and gender identity, and how they're treated with regards to what college they should go to, what field they should enter in, whether they are a woman and shouldn't do sciences. They push women more towards education or other kinds of fields. So I think all of these things kind of show up when we look at educational disparities.
I would add to that, and actually I was looking at the chat, saw that Joe had a question.
Yeah, Joe's question was, what do you all see as the top 3 educational issues here locally?
Definitely a suspension. We got to stop suspending our Black and brown kids. We just have to, especially when you look at the numbers and you see, you know, Black and brown children are 3 to 4 times more likely to be suspended. That's systematic oppression. So that has to stop. So for me, that's number 1. Number 2, I would say we need to increase the Black and brown teachers that are in the classroom. There's another statistic that says if a child before 3rd grade has a Black teacher, they are like 13 times more likely to go to college.
Mm-hmm.
That's how much of an influence Black and brown teachers have on children. So that would be my top 2. We need to do more inclusive hiring. And I think number 3, personally, we need to reevaluate what a failing school is, and think about how a child thinks when they find out they go to a failing school, and what that does to their identity, what that does to their self-esteem. I think we need to figure out, are we grading schools based on a white standard, or are we grading schools based on their growth? Are we grading schools based on teachers' instructions? You know, I think we also need to look at standardized testing. Does standardized testing work for all children? And I'm sure the answer is no, it doesn't. And I would say that because I don't do good on standardized tests at all. And so, you know, we have to do better. And I know you said top 3, and I probably did 4, but this is my last one. Number 5, we can't do neighborhood schools. Not in Wilmington. Okay. And I know the parents fought for it. I know they argued. I know they showed up to the school board meeting with t-shirts, and it was very sad. But when you walk out your neighborhood, and if you look to the right and the left, and everybody looks like you, when you go to school, you're going to get that same kind of experience. And we owe it to the children in our community to have a diverse education, to go to school with people who don't look like them, who don't think like them, who don't have the same wealth bracket as them. We owe it to our students to have a more inclusive environment. Now I'm going on mute. Sorry, Joe. I know you asked for 3, but give me a little extra.
Thank you, Jhaniqua. I think that was right on target. But
I was going to say my first one was going to be suspension. Definitely neighborhood schools. Like, that's actually something that shouldn't be anywhere. It's just no. It's just a no. There is segregation here in Wilmington when it comes to schools, and it goes back to the same thing people think about racism. They think that it's just the overt things. I'm like, no. No, racism is also covert. It is weaved into everything. And so, especially here in Wilmington, what I've seen, because I used to work directly with students here in Wilmington in an after school program, and to hear what they were saying, like to hear Black students talking to me because they felt comfortable with me, right? And I'm an after school program person. So I was like, okay, I'm not a teacher, so they're just going to tell me stuff. And I was like, wow, this is actually ridiculous that they feel this way about their teachers. They would tell me different instances about racism, like things like that. Like, but that goes back to Jhaniqua, like you were saying about having teachers that are Black and brown, because there should be no reason why you go into a school and there's one Black teacher and they happen to be the PE coach. Like, really?
Okay. Or
like,
they work in the cafeteria. Or they work in the cafeteria, or they're the janitorial staff.
Right.
And I'm not saying that as to say something is wrong with those positions.
No.
But children need to, and this is why I love Sabrina Hill Black. Children need to see people in power who look like them. Yes. And it's not just for Black students, white children, all children, period, need to see people in power that look like them so that they know that they can be empowered to do that as well. Right. You know, I feel like it's not rocket science. Like, come on, people, like, come on. Mm-hmm. And it's not hard to recruit Black teachers. I am pretty sure most of the HBCUs in this country have an education program, okay? So there are tons and thousands of Black teachers who are graduating. And what does that look like? That looks like you may need to pay them more. Mm-hmm. Mm-hmm. You may need to increase the salaries of teachers. Mm-hmm.
Yes.
Because when they come to Wilmington, they can't make $30,000 a year and afford an apartment. So that may look like we have to create some equitable, livable wages here so that we can have an inclusive environment. And again, this goes back to my point that when you want equity, diversity, and inclusion, you have to have it interwoven into your strategic plan, interwoven in your leadership, so that it becomes a part of the essence of your organizations. Like, it has to be interwoven. Okay, I'm gonna go.
With that, and also just the question needs to be asked: why aren't Black and brown teachers wanting to come to Wilmington? Like, that's the other question. Like, that's another question, right? And it's been asked before, and I actually know people who are like, I'm not going to move to Wilmington. I wouldn't move to Wilmington. That are Black people and that are brown people. And you want to know why? Because of the racism here in Wilmington, because of the lack of like paying teachers an actual wage. And I want to say more specifically though, Black teachers and brown teachers, and wage that they deserve, more than they deserve, to be honest, if we're going to go there. But I mean, if we're going to be serious about it, right? But like asking those questions too, like getting the bigger picture, and choosing to be intentional, because those conversations go into what we were talking about before with inclusion. Those conversations are about being inclusive, not diverse, inclusive, because then you're wanting to truly understand, okay, what needs to happen? Who do we need to have at the table at all times, leading these conversations? That is not someone who does not have this lived experience, right? So, but yeah, I actually, off the top of my head, I wouldn't add anything else to the list, to be honest. So, yeah.
I think that's amazing and a perfect segue into my next question, because at one point in time, and I remember this being a bit of a debate here on Facebook locally, right? But at one point in time, we were reading about the school systems having these policies posted on their front doors or at the door of their principal offices saying, you know, no hair rollers, pajamas, or bonnets allowed, right? And bonnet is, you know, the sleep cap that we wear to bed in our culture, right? And they're saying, okay, the moms can't come into the principal's office or the school if they want to wear these things, or if, you know, maybe think about it, maybe that's all they got to wear. Maybe they've been up since 5 o'clock in the morning running kids here and there. Maybe they had doctor's appointments. You really don't know the reality of the situation, but basically you're telling them that they're not allowed in your facility, the school system, to be there on behalf of their child if this is how they're showing up, right? So I also think about healthcare. I think about the hospital. I think about how we talked about last time, what you are wearing to your doctor's appointment even historically could influence the type of care that you get, right? So we talked about things like also the idea of a welfare queen. We talked about the idea of mother blaming. We talked about code switching. So how has respectability politics and our society valuing political correctness over Black people, Black women, Black men, and brown people for that matter, showing up authentically, shape the gaps that we see in having access to culturally competent, bias-free healthcare for Black women?
Okay. Lettie, you want me to go first?
You can go. I'm just, okay. I have like some things happening and yeah.
And yeah, I see it's firing. It is. All your neurons are going.
It is. It really is.
So the one thing I would say is respectability politics, again, does not save Black people. It has not saved a life yet. And if it worked, I would be for it. And I think when you are creating an inclusive environment, you are giving people the permission to show up as their authentic selves, meaning what they look like may make you uncomfortable, but it's not about you. So if I show up with no bra on, no hair rollers, crust in my eye, bedroom shoes, because I am dropping my child off, I am doing the best that I can to drop my child off. And I think we have boxed ourselves in what authenticity looks like. And I think that we have not given Black women, Black people permission to do that. And it's become a thing, which is why you get the Crown Act, right? And if you're familiar with the Crown Act, it's pretty much saying that Black people can wear their hair however they want it. So whether it's a big afro, whether it's locks, whether it's a blowout, wherever they want to show up with their hair, they can legally do it. Now, why do we have to legalize it is actually the question. Why do we have to legalize Black people being authentically themselves? And the reason is because our country has the buy-in of respectability politics. So yeah, I think that, and that's discriminatory. You can't tell a mama how she gonna come up to the schoolhouse. I think that's ridiculous, and it targets that's the other thing, it's targeting Black people, like it's targeting Black people, and it's condescending, and it's making people, it's oppressive. It's oppressive. You saying I gotta put on a full face of makeup to come and visit you, but who are you, boo?
Mm-hmm.
Okay, I'm going on mute because I feel myself getting a little heated.
Yeah, I have a lot of thoughts. Yeah, I think about how Black women particularly, like, we aren't allowed to be soft, right? We always have to show up and be this or be that, but not too much of this, and then you're gonna be aggressive. Oh, but then you can't not be too relaxed, because then you're gonna be seen as lazy. Oh, but you have to make sure that you're dressed this way so that you even get called into the office for the job interview. Oh, but don't dress like that too much, because then you're going to be seen as being promiscuous, right? So there's actually not a time, and we're not trying to teeter this line of, yeah, like respectability politics, but also how the Black woman's body, how our bodies have been seen historically, right? And so that's one thing. We were talking about DMX before, and I thought about this then too, how DMX, because of his rap music, and I grew up listening to a lot of DMX, right? But as soon as people found out a couple years ago about what he was really going through, he wasn't allowed to be soft. He wasn't allowed to be his authentic self. And I say soft in that way because we as Black people are seen as needing to be, or as hard and as strong, and can never show weakness, right? And that's the stuff that gets passed down generationally, because it was always about survival. That's what allowed our ancestors to survive. I have two parents that still have similar mentalities to that, because they lived in the Jim Crow era. Like they lived it, right? So they remember what it's like to be in that survival mode. And that's another big component too, is and actually I know that I always have some kind of history quote, but James Baldwin said something one time during an interview. He said, and it was a few years before he passed away, but he said basically, and I'm paraphrasing this, that Black people in this country are measured by how fast they can become white. And what he meant by that is what, Jhaniqua, what you were just talking about, with how we have to appear, right? Like, we can't appear as ourselves. And actually in Dr. Joy DeGruy's book, Post-Traumatic Slave Syndrome, she talks about this a lot, and how a lot of what we do as Black people is actually rooted in like African heritage. Like, that's where it comes from. And if people even take a minute to read a little bit about that, they'll understand, right? And yeah, things like not being able to wear a bonnet, okay, but like I've seen people who are not Black coming in with their hair looking messy, they don't have on shoes, and they're able to walk in and do whatever, and they're given a pass because of their skin color. But it also goes back to what I was saying before about the criminalization of and the condemnation of Blackness. And this is what it is too, right? This also encompasses that, like how we're seen as negative, because these actual images, right, of the Black woman going into a school, like how that paints us as, oh, see, we just don't care. Or, oh, see, well, they just don't care because they're coming and looking that way. What? I mean, that has nothing to do with you. How someone is dressed has absolutely nothing to do with you. I think it costs $0 to mind your business. And I think more people need to really accept that, because it's really a problem. And like, if you're going to show up to a school and you have on a bonnet, okay, you're showing up as your child's mother, period. Full stop. That is it. Right. And so we are not only policed out here by police officers and by this country, but our bodies are constantly policed by these laws and these policies every single day by going into a building. Right. And so these ideas, right, and like Black children seeing this, while they're soaking up everything else, they're soaking up these racist ideas as well, which goes into internalized racism, I think, and then that manifests into adulthood, right? And so again, everything connects. Yeah, that's my answer.
And Lettie, I think the other thing is we also have to take into context. The reason I wear a bonnet is so that when I comb my hair down, it still looks silky.
Right.
So let's understand my context first.
Right.
And let's also talk about access. Hair rollers keep my hair curly so that I can have curls.
Mm-hmm. Right.
And clothing means I have money to pay for clothing. It means that I have the budget to afford the appropriate clothing. It also assumes that I have a house and I have a home. And like it makes all of these assumptions where if you deal with the school system, you know that people are homeless. You know that you have students who come to school with their mom maybe just drive around the corner.
Mm-hmm.
And so I think the other thing is like we're not taking into context some of the other ways that disparities show up in education. And we assume that everybody comes to the table with the same knowledge and with the same resources. And that's not the case. And that's definitely not the case as a mother. And definitely not the case as a Black mother, especially when we look at the wealth gap or the pay gap, the pay rate gap between Black women and others. Like that, we can't make that assumption. So yeah.
Wow. I love it. I love it. I love it. That is so true. And I mean, to your point, Jhaniqua, you don't know the full story, right? I could be doing my laundry. I just threw this on to show up at the schoolhouse, but I'm here, right? You really don't know the full depth of the situation. And it's so easy for people to pass judgment when they don't understand. Lettie, you mentioned something, well, you mentioned criminalization again, right? And that takes me to my next question that I want to address, because we talked just a little bit about intersections of, housing, education, justice, and how that ultimately contributes to our outcomes that we see in maternal health. So in terms of the justice system, when we look at mass incarceration and the over-criminalization of Black people, a lot of families have been impacted. And sometimes this places a strain on matriarchs of the family, right? We just talked in one of the previous sessions this week on Tuesday with Kim Seals-Aller. She was mentioning some of the I won't say prehistoric, some of the older housing policies around public housing, right? Like you were not going to get assistance or benefits if you had a man in the home, for instance. So that in turn incentivizes breaking apart families. And we referred to this as almost being sold on the auction block when we talked about mass incarceration last time we met, right? So what does this look like or manifest as in terms of mental health for Black moms or for Black communities as a whole? When we think about the stress factor, when we think about the lack of support, when we think about the financial strain, because I often think that people don't kind of draw these conclusions or connect the dots, that all of these things come full circle and you really have to understand them all to really get the full breadth of the picture.
Yeah, the first thing that I thought of, and I'm kind of just starting at a point, not really starting at the beginning, but starting at a point. First thing I thought of was whenever Black men in particular go to prison or go to jail. And before that though, right, there's bail money that's needed or court fees or whatever that is, right? And think about how many Black families now, present day and throughout history have said, okay, well, we're gonna need to give up our home, or we need to sell this or sell that, or I need to now I find other ways to make money. And whatever that may look like, that's the first thing that comes to mind. And really it's because people don't connect that, right? I've seen this firsthand with my own family, different family members and things like that. And I have friends that have experienced this too, where it comes down to socioeconomic issues at the root of it, right? Whenever you have things like no cash or like cash bail, right? Like why it's now a thing that's like in cash bail because of what it does to the Black communities, what it does to Black families, but also the strain it puts on Black mothers. And I'm using Black mothers right now, like saying that because I'm talking specifically about Black men going to prison and jail, but the strain that it puts on them, what it costs the children as well, how then this is seen in the white community and how then it justifies these racist laws and policies to continue to be written. And I'm just going surface level because I could like go super in depth, but for time-wise, I'm not going to because I could just go off. But I think about that. I really think about that in the show When They See Us. That was the four-part series that Ava DuVernay did, which I watched once, and it was a lot, but everyone should watch that. But I think about whenever Corey Wise's mother was traveling to go see him and how she couldn't continue to do that, right? And if people watch the interviews with her, the actual interviews with her, and he was out of prison in real life, and hear her story about what it was actually costing her to do that. And that is the story for hundreds of thousands, millions of like Black people over time. And in history, we see this often, and I'm going to say this here too, something that's really not told the right way, now it's starting to more, is the Black Panther Party, right? People look at the Panthers and they're like, oh my gosh, they were violent. No, they're like my favorite group in our history because they had so many programs. They actually had an entire program that was for Black maternal health, an entire program for that. That was,
they started WIC.
Yeah,
they started the WIC program. They started the food stamp program.
They started so much, and that's why their 10-point program had specific things in it. And one of them was about Black men not going to war. It was about Black men not being arrested. It was about police brutality because these were the issues that were separating the Black families. And so mass incarceration, look, at this point, if there are people who are watching this and y'all haven't watched 13th yet, just go watch 13th. That's what you need to go do. Because we ain't gonna sit here and just continue to repeat that, because at this point, that's like required watching for a foundational understanding, because it's facts. And if you haven't read The New Jim Crow by Michelle Alexander, that book, if you can read that book and actually still think that mass incarceration is fine on any level, then like you didn't read the book. You just didn't read it. And so accepting the fact that mass incarceration is also directly linked to convict leasing and to labor camps. Whenever America decided to criminalize Black people after the Civil War and found any and every reason to arrest Black people and put them in jail. Anything at all. It can be a made up thing. It just didn't matter, right? And then how you connect mass incarceration to these bigger companies like Coca-Cola, like to Delta, to all of these places that the old money travels all over it. Yeah, but I say that to say too, how that goes with wealth, how that ties into wealth and how it ties into what Black children see, what Black children are told about themselves, what Black girls are not told, how there are budget cuts and underinvestment in programs for the Black community. And there's plenty of money out there for it, right? So, and I know that I just said a lot because I was trying to like touch all the points I wanted to make, but they all do connect, right? Like they truly do. Mass incarceration. Yeah, I'm just going to stop there.
Yeah, Lettie, I think you said some really, really great points. I think one of the other things I would like to point out is with children, foster care reports or DSS reports, the Department of Health and Human Services, when teachers, school workers, social workers, people, school staff, police officers, when they make allegations about Black and brown children, a lot of them, once they're investigated, they're found to be unfound. However, if there is something there and children have to interact at all with the criminal justice system, their families tend to never be the same. And so, that looks like social workers are always in and out. Parents are always scared, am I going to get my child taken away? It looks like, maybe Black and brown children going to juvenile hall and being in juvenile hall. And what those numbers look like, those numbers are actually very staggering. There was a study done about juveniles in custody in 2015, and Black people made up like 164 out of like 468 juveniles who were in custody. That is a lot. That is a high percentage for our Black and brown children. And so when we think about how Black bodies interact with the criminal justice system, it seems very much like slavery. Once they're in the system, they're bound by the system. They don't have money to get their records expunged, which means that limits the jobs that they can get, which means that limits their wealth. It means that limits their access. For some people, it limits them for the rest of their lives. I think there are great organizations that are out here that are doing some phenomenal work, like Step Up Wilmington, who works with offenders, work with people who have criminal backgrounds and trying to find them equitable jobs and trying to get them, make sure they're educated and have a high school diploma. So there are really good organizations that are out here doing the work. However, if we did not criminalize Black and brown bodies, we wouldn't need this to happen. And I think we have to figure out, when it can stop. It might start with decapitalizing the prison system, which means, prison systems aren't wealth markets. I'm pretty sure if somebody owns a prison right now, they will be crying because they don't want to hear that. But it's difficult. It is difficult. It's difficult.
Thank you both. Let's see.
Yes.
Go ahead, Jhaniqua. Were you going to read this question in the chat box?
Yes. Someone said, can you talk a little bit more about
moms being afraid of their children getting taken away? How do we make ourselves a safe place for women going through tough situations without having that fear of being reported?
I think it looks like having authentic relationships with moms. It means that, another part of my job, I work with grandparents raising their grandchildren. And so I have to walk alongside them. So instead of, me reporting that there's food insecurity at the home, I figure out a way to make them a food referral. I figure out ways to get them the resources that they need. I figure out how to maybe link them up with the United Way older adult program that employs seniors. You know, I think the thing is that sometimes when we assume, and again, when we're not aware of our biases, that we make all of these assumptions about situations and circumstances based on what we see without having relationships with parents to figure out what's really happening in the home. And I think that is the best way to do that. I think that making reports are important, especially if you are thinking that the children are abused or if they are in a harmful situation. But I think that there are steps before picking up DSS and making the report, because once that report is made, you cannot take that back.
Yeah, that's a really good point, Jhaniqua. I also was thinking about something, something that happened a couple years ago with someone that I know that does not live here, but I just want to say that. But I do remember her telling me that she was frustrated because one of her friends was a teacher, and they did like home visits or like. Sorry, my FaceTime is connected to my phone. I mean, it's my Mac. Sorry. But she was frustrated basically because home visits were being done for something, I forget exactly what, and a Black child answered the door and there was no one else home except him and his brother, I think it was. And I'm saying this example because this happens often. This is actually how I grew up. My mom was at work, we were at home, and we were fine. Right? Like grandma was next door, aunt, uncle next door, we are good. But what happens is too often oftentimes white people will be like, oh, but that's neglect. No, it's not. It is not neglect, right? And so what ended up happening was my friend, like she had to like tell the teacher, like, no, like you don't need to call anyone. Like the children are safe. Their neighbor next door knows, like they're home. Their mom works two jobs right. Because she was in essential, like she's working and there's no one else to watch them and they're fine. They are safe. And so I know that I said this earlier about like minding your business and I kind of was joking, but also not, because seriously though, right? Like it becomes a danger even more for the family. And then you're in situations where just because a mother's not home with her children, she's looked at as not a good mom. When really what it is that it goes back.
She's trying to provide.
Right. She's trying to provide. And it goes back to what we've been talking about this whole time with all these factors, right? Like how she grew up, like what her parents did not have access to, what she's having to do now, where she like socioeconomic issues, right? And it does not make her a bad mother. I mean, she loves her children, right? And so it just goes back to the criminalization of like Black people and why Black women are looked at that way. Like,
and if you don't parent the way I think you should parent, then you're being negligent. Right. When that's not the case. But again, if you develop relationships with people and know like there's a gap when I can care for my child, create a resource, connect them to a resource. Don't just automatically report them to DSS. Right. And there was another comment on the Facebook that said when we were talking about the mothers not being able to go in, is that if you stop access for parents if you stop the access from parents to be able to be involved in the school and with education, you stop the parents from having the knowledge of what's happening. And so a part of that comment was saying that when you create policies like that, you're actually trying to create an equitable system that keeps parents from being involved in their education, in the education of their children.
Yep.
Yeah, that is so true. So true. All right. Well, I've got one more final question if we could answer very briefly, and then we will close for the night. So I want to go back to our Tuesday session and included a keynote presentation from Kim Seals-Allers, and I see some of the people on this call were actually there. And she's the founder of an app called Earth. And Earth gives moms an opportunity to share their experiences, whether good or bad, in navigating maternal care. It also gives, birth workers, doulas, people who are supporting these moms, an opportunity to do the same. So it's kind of like Yelp for care providers. So this in turn does not only create accountability, but it gives people a platform to have their voices heard. So similarly, for the end of this month, we have organized under First Year Cape Fear listening sessions to highlight local stories from local moms in navigating healthcare and what their experiences are. So let's talk a little bit about why these types of organized opportunities to share feedback and experiences are important for both moms and providers.
I'll go really quickly, and I say it allows providers to be held accountable for the experiences that their patients are receiving. And it gives patients a platform and the safe space to know that their experiences are what they have experienced is desired. What they have experienced is important and is valued, and it also gives providers an opportunity to make better practices, have better practices, treat people better, be more aware of how they are being received.
Yeah, I would say that. And also it allows people to see, oh, okay, I'm not alone in this. Like, I'm not the only one that's experienced this. Oh, all right. So, and then whenever someone else speaks up, it gives someone else the courage to also do that too. And I think that's really important for Black and Brown communities to have that sense of, community, not to sound redundant, but yeah.
Yeah, I would absolutely agree. And to add to that, I think that not only does it create accountability and gives people a platform to really have their voices heard and amplified, but often, as we learned in Tuesday session, people don't know how to engage with communities that they serve. They don't have opportunity to, they don't know how to make the effort to. So opportunities like this are kind of once in a lifetime to actually take this information and apply it to your practice, right? So it's very important for us to leverage them and very important for us to be willing to share our stories, I think, because we could save lives ultimately in being able to influence the way someone makes decisions and the way they understand us as Black women. I see your question, Whitney, about if you are able to listen in on these listening sessions. The answer to that is no, but we are going to share the results. This is a IRB study, so we're working with UNCW School of Nursing, and it's going to be confidential. Somebody's going to be analyzing the research. All the names will be kept confidential, and so once the results are analyzed, we're going to then share them with the community. So you will get a chance to see the feedback, but you can't sit in on the session itself. All right, well, we are coming to a close and we're at the end of our session tonight. So thank you again to our panelists and thank you to our audience. As we've learned all week, there's a lot of value in making our women feel seen, heard, listened to, cared for. We also need to really understand and acknowledge the history behind all of this and how these things intersect with all of our systems when we look at structural and institutional racism. So we appreciate you joining us, and we hope that you've learned something new and will continue to advocate and educate around birth equity and justice way beyond this week, okay? So not just this week, but forever and ever. So once again, I invite you to learn more about First Year Cape Fear by checking out our website or our Facebook page. And once again, our listening sessions are going to be hosted at the end of this month. You can learn more about those at firstyearcapefear.com/events. Or you can email us directly at info@firstyearcapefear.com. So thank you again to our wonderful panelists, Jhaniqua and Lettie, and thank you to our audience. Thank you. You all enjoy the rest of your night.
Thank you. Bye.
Bye.